Guys, I mean, am I audible and can you see me now?
Yes, Sabine, we can see you.
Okay.
Okay. Thanks everybody for joining today's panel on hospitality and healthcare operations. We are going to talk about a lot of innovations, challenges, and policy changes in the hospital and healthcare operations today. This is Pankaj Gupta from EthAum Partners. And to the people who are seeing me on LinkedIn, they may be a little bit tired because this is the second panel that we are doing today. Today, we have a fantastic panel to talk about the innovations and trends in the hospital and healthcare ecosystem. We have Zubi, we have Dr. Ilan, we have Karan, and we have Dr. Eve. Obviously, we have Max from Soapy. Max is the founder of Soapy, which is one of the portfolio startups that we onboarded in January 2023 program, and with whom we are hosting this panel today. Now, I would request Max to give a very high-level introduction of himself and Soapy, and then I would love our panelists to give a brief intro of themselves. Max?
Pankaj, thank you. And it's great to see everyone. My name is Max. I'm one of the founders and the CEO of Soapy. I'm coming from medical science background myself. Soapy is helping healthcare facilities to prevent infections, cut loss related to infection that is spread in healthcare facilities. We're based in Israel and the United States. Started our journey back in 2018 and have already customers in Europe, United States, Israel, and even in Asia. Now, happy to share more, but I would like to learn about you, the panelists.
Fantastic. Dr. Ilan, please, a brief intro.
Yeah, I'm Dr. Ilan Kalimurthy, currently based in Chennai. I'm the CEO of Varela Hospital, which is a 450-bedded hospital. It's India's largest liver transplant center. I'm basically a liver anesthetist intensivist. Got experience of more than 20 years in UK and in India. Currently, I play dual role as the Chief Executive Officer of Varela Hospital and also the clinician on the other end, actually. So I got experience of managing more than 2,500 liver transplants. And that the hospital is currently 5 years old, nearly. And it's India's one of the 38 JCA accredited organizations.
Fantastic. Thanks a lot, Dr. Ilan.
Thank you.
Zubi?
Good evening, all of you. So I am currently the Senior Vice President, Marketing and Business Development at Kokilaben Ambani Hospital. We currently are 3 hospitals based two out of Bombay and 1 in Indore. Totally about, say, 1,500 beds. We are consistently ranked in the top, hospitals in the country. In the recent Newsweek survey, we were ranked number 6th on the list of the best hospitals in the country. And my background has been medical devices. I was an entrepreneur. I had a startup in medical devices. And thereafter, I was in consulting in Frost & Sullivan. I was looking after the healthcare practice, which included medical devices, health IT, and globally, I launched healthcare delivery for Frost & Sullivan. Then I moved as a new director for new business development with Johnson & Johnson across all their medical device franchises, which were 8 of them. And finally, last 10 years, I've been at Kokilaben Ambani Hospital, spearheading the entire marketing and business development. We are, consistently ranked as one of the best hospitals. So that's one of the, feather in the cap for all of us.
Thanks a lot, Zubi. Really appreciate it. Dr. Eve?
Yes, good morning, at least good morning here from New York City. I am Eve DeRosa. I'm a physician practicing, but mostly administrative. I'm the chair of the emergency department at Lenox Hill Hospital, which is part of Northwell Health System, which is the largest healthcare system in New York State. We're about 15 billion in revenues. We have 23 hospitals. So my primary responsibility is for the emergency department at Lenox Hill, and also a VP for the Western region, which includes 6 hospitals. I also work with and advise and mentor a lot of startup companies in the New York City area and also internationally. So just very excited to be here with such an esteemed group.
Fantastic. I see a beautiful picture of Lenox Hospital in the background. So that's great. Karan, please.
Good evening, everyone. It's a pleasure to be here amongst the elite panelists. My name is Karan Puri, and I'm working with Apollo Hospitals, currently based out of Chennai. And I'm managing a hospital, which is a multi-speciality hospital from the last 3 years. I think a lot of us healthcare professionals would have seen tough times of COVID. And we've seen how healthcare professionals have changed the dimension of people and how we've touched lives. In my past experiences, I've worked in diverse markets in various roles of sales and marketing, admin. I've worked in West Bengal, Calcutta. I've also done an overseas stint in Africa, which was my previous stint before Apollo. And there I was working as director of operations. So yes, happy to be a part of this industry and looking forward to converse with all of you.
Fantastic. With this kind of panel, I'm sure that we are going to have really insightful conversation, interactive conversation today. Max, now it's your turn to take out some interesting questions from your pocket and get the insights, please. Unmute yourself, Max.
Pankaj, thank you for that. And again, I'm excited to be here. And I hope you'll be excited about the questions that I'm about to ask everyone. So I would like to start, if possible, with Dr. Ilan. Like, there is a lot of things that are happening within the healthcare environment. And one of the things that I was pondering about was, if you look at the challenges that are happening today, with all what happened in 2 years, what are the most painful challenges that you see as an executive in healthcare that for you is a big concern today?
That's a good question, Max. I wouldn't call it as a painful challenge. I would call it as a challenge. I think most of the healthcare organizations are facing today, and we are all trying to sort it out. I think it's a real challenge. What we expect is a fruitful outcome, actually. So I wouldn't call it as a painful challenge anyway. So the thing is, if you look at our country, India, I think you are based in Israel and the US, you said, but India itself has got some unique challenges, actually. Because if you look at the healthcare delivery, it's completely diversified. If you look at government participation, we have only 20% participation in terms of healthcare, and another 80% is provided by the government, private sector. And again, there is a huge variability between urban centers, and also if you go to the periphery, the quality of care will be different. I think the biggest challenge as a healthcare group, we as a healthcare group, is to give accessible and affordable care to the whole population. I would say that's one of the biggest challenge we are facing at this point of time. I'm sure over this conversation, we can figure it out how we can overcome this particular challenge. Maybe some of the technological development can sort out accessibility. I'm sure telemedicine and those things can sort out accessibility. I'm sure many of these AI tools can also reduce affordability. Patients should be able to afford high quality treatment with the new innovations. I think this challenge can be addressed by the current technological innovation, I will call it. And then even if you look at in the last 5 years, there are a lot of things are happening in the healthcare landscape. Even COVID times, even in our country, you could have noticed that telemedicine wasn't very popular before COVID, and there is a sudden change of telemedicine. We, as a doctor, started using Zoom and then started telemedicine tools to reach people at home. I would say, this is one of the major challenge where patients would want to get treated at home. I think that's a mindset is changing over the period of time. As a healthcare organization, delivery partner, we have to prepare ourselves to deliver those kind of care what patients are expecting at this point of time. That's a pathway we are all moving forward. At the same time, the technology is developing, new innovations are happening, new equipment is coming, there's a new software coming, AI is developing on its way forward. I think all the hospitals need to adapt this kind of technology. I think that will be another challenge we have to face in the next 1 decade, I would say, because AI is a new concept. It suddenly popped up in the healthcare in the last few years. I think it's important for a healthcare organization to adapt the technology quickly and then deliver to their patients. I would say these three are main important, which comes to my mind immediately for your question. Maybe I will listen to the rest of the people. Maybe I can add more points at the end if I have time, actually. Is that okay, Max?
Yeah, it was a great, Ilan, thank you so much for your answer. I don't know if any of the panelists would like to add to that, because I know that we have kind of an international panel right now. So if any of you, Zubin, maybe you would like to add something.
Yeah. See, I think to what Ilan just mentioned, I think definitely one of the challenges in a developing economy is about, affordability, While having said that, I think, one of the biggest challenges, I think, in this country is also about infection. Whether we are talking about a large, hospital, or whether you're talking about a small, healthcare delivery place, infection is one thing which is one of the most, challenging and evading, I'm talking about hospital acquired infection, right? I mean, I'm not talking about infection as a subject, because that we all know that, no matter how many antibiotics we have, we are becoming antibiotic resistant. So I'm not getting into that infection. I'm getting into the infection which is hospital acquired. And I think that's one of the biggest challenges, because no matter how good your setup is, if you are unable to control infection, whether the surgery or whether it's a medical case, it's going to, eventually end up with a mortality. So I see that as a very big challenge, and I really uh, uh, don't really see any solution uh, in the near future. And I think Soapy is, if it makes a mark, it'll be a terrific thing, because uh, it's been kind of recognized that hand infection is one of the most primary sources of infection in many of the hospitals. Many places don't use even simple hand hygiene principles. People use shortcuts while using infection liquids. So I think that's one of the big challenges which I foresee, where at least they say it's 5%, but I think it's at least 10 or 15% of the overall, infection rates, and that is where I think it's a big challenge, to add to what Ilan just mentioned. Thank you.
Zubin, thank you very much. And I'll be happy to share a bit about Soapy after. But Dr. Eve, do you see any of this in the United States healthcare system, especially in New York, which is one of the most interesting and complex systems in the country?
Very, very interesting. As I was listening to this conversation, I said, we might as well be together. I mean, the challenges are not that much more different. I mean, we have definitely, to pick up on the theme of accessibility and affordability, that is a challenge in the US. In our system, we have a couple of different types of insurance products. Well, first of all, there are people who are uninsured. But for those who are insured, there is the government program, what we call Medicaid and Medicare, which is, quite frankly, doesn't quite pay the bills. If at best, it keeps you neutral. What is subsidizing the care are the commercial payers. But most commercial payments depend on the fact that you have to work to get that insurance. To buy it out of pocket is astronomically expensive. So what that means, when you put this all together, it puts tremendous pressure on a healthcare system such as ours. I mentioned $14–15 billion in revenue, but guess what? At the end of the day, we only keep about 1 to 2% of that, 2% on a very good year. And during the COVID years, we actually didn't make our margins. So what are you left with in terms of dollars to really get to your mission of quality of care, efficiency, timeliness? And the other challenge for us is the patient experience. Now we're talking tech, we're talking very high tech here, but I would caution, one of the words you're not going to hear in these tech presentations is empathy and compassion. Unfortunately, we're starting to get to a space where our doctors and nurses are tremendous pressure in terms of the tech and all the information. And that's causing burnout in so many ways. And we have to, at some point, while using the technology, get back to the fundamentals of why these doctors and nurses are working, and the compassion away from the bedside. A lot of what you mentioned in terms of hand hygiene is because the providers feel so pressured to do things. There are alarms going off. There's all this data information. And again, we're missing the basics of simply washing your hands. We're missing the basics of sitting down with patients and actually speaking to the patients. So I would say, as we build all these technologies, which are useful, that we remember the fundamentals and basics.
Thank you very much for that. I'll try to summarize before jumping. Well, actually, I have a lot of questions for this question, but I'm happy to take it maybe offline with each one of you. But from what I hear, you're speaking about making healthcare affordable for the end users, right? At the same time, somehow connecting that to the last mile to make that more accessible to where they need the healthcare to be provided. But at the same time, even though we have so many technologies jumping into the market, we are forgetting that people are using those technologies, right? And we need to think not only about the end user that gets the care from us, but also about the people that actually providing that care. And Dr. Reeve, thank you for saying that, because that's actually bringing me to the next step question. And Karen, maybe you can jump into the conversation saying about like what kind of solutions and innovations you think are needed, especially when we think about the last mile, the affordability, the compassion, and the user experience that we so need in the market right now, on the both side of the coin, for the users and also for the clinicians, the nurses, and everyone who is in the healthcare system.
So I'll just give my views on the same. I think when you were talking earlier, and I think all the panelists were making a point, I believe healthcare, what it is now, it's changed and it's evolving every day. And that's one challenge we all face. Now, when I say that, with times changing, we've experienced the needs of a patient, the demands have multiplied, and that's expected. And when they are coming in to a hospital or to a clinic, or when they are meeting a consultant, they demand a lot many things which was not the case earlier. And when I say that, when you talk about the last mile, small things, starting from their convenience of a car park to how much time are they waiting in the OPDs, because everybody has less time and they would want to make sure that the time is utilized in a good way. Nobody wants to wait in a hospital for even 5 minutes. And as we all know, we have that phobia. As a normal layman, you would not want to come to a hospital where you know you have people who have infection. And what COVID has taught us, you know it's in the air. You've got to wear a mask, you've got to take so many precautions, and then enter into a place where you have sick patients, you have infections, nobody wants to come in. And that is when tech plays a role. It has its own pluses as well as its minuses, where I know a lot of dependency is coming on tech. At the same time, that touch of a technician, of a doctor is missing. You've got tier 2, tier 3 cities where you don't have good corporate hospital private setups, and people do walk into the bigger metros. But when you talk about affordability, I do understand there are doctors, there are medical programs we have made in a way where we are in touch with the remote possible areas, and we are giving them updates on medical. Plus, we have our clinicians who are going into the remote areas and making sure that they're meeting more people. And that's what we are trying to do. We have got some success, but still a lot needs to be done on that area.
Thank you for that. It's very interesting because it's highly linked to, like we mentioned right now, telemedicine a couple of times, and we mentioned technologies. But at the same, one of the questions that I hear right now in kind of in between the lines is that how you maintain quality, right, of the care, because we can throw the technology into the market and hope for that will be good quality enough. But then you can't really eliminate the teams that are practicing medicine. And Kiran, correct me if I'm understanding that wrong, but what you're saying, even though we need to improve the flow within the facility, even though we need to bring the last mile care to our clients, but at the same time, how you kind of mitigate their fear from coming to your facility when it's needed, right? And saying, we have more technologies that will help. The question is, do we see technologies that actually doing that right now in the market, or we see just a lot of seeds and we hope that some of that will help with what you just described as a flow and fear challenge at the same time? Dr. Ilan, maybe you want to jump?
Yeah, sure, Max. Actually, again, it's a fantastic question. I'll just start from the patient's perspective. I think, to be frank, patients are not really bothered about what technology we use as a doctor or healthcare facility. They don't mind, actually, to be frank. Whether they use AI, blockchain, doesn't matter for them. What do they expect? They expect very few simple things. They expect cost-effective care, high-quality care. They want their disease to be treated. You understand? Previously, how we were using phone was used only to make a phone call. You understand? Actually, rest of the things can be done by something else. We don't need a smartphone to use for rest of the things. The phone is used, it should be used only for the phone call. That's what people will be expecting. Healthcare also same. They expect a very simple solution for their problem. It doesn't matter what technology we use. So this is the expectation from the patient side. So from the healthcare side, we shouldn't project too much about what technology we use. We need to project how we solve patients' problem. We might say, I want to use AI. Patients don't mind what you use. But if AI can solve a patient's problem cost effectively with good accessibility, patients will easily accept it. I think we are seeing quite a lot of innovations and research, or a lot of technology coming in the last 5-7 years. Maybe if you look at after 5 to 7 years, many of them might have disappeared because patients might not have believed all these technologies. They just wanted a good quality service at the end of the day. Am I right, Max?
Well, I think you're more than just right, because I'll take the patient side right now, right? If I go to get any type of care, I want the end result. I want to be healthy.
Exactly.
I want to be safe. I want the quality to be at the best it possibly can be. And yes, I would like that to be affordable, right? And not consider, should I go to a hospital and pay that money, or I will stay at home. Hopefully it will, my body and my immune system and the rest of evolution will take care of the problem by itself. So I definitely.
Yeah, what I was trying to say is healthcare organizations shouldn't forget the need of the patient. They shouldn't get diverted into bringing in more and more technology, high cost, increasing the cost. Patients might not like it. We need to use the technology, adapt all the innovations, all new tools. At the same time, we shouldn't forget what patient needs. They just need high quality care with a low cost or optimal cost, with a good accessibility and affordability. I think these should be bridged very carefully. I think that's what I was trying to say.
Dr. Reno, thank you very much. I will use that to elevate one of the other questions. And you mentioned AI and you mentioned blockchain. And we hear a lot about ChatGPT and the other platforms around that are speaking things. My question is like, Dr. Reeves, if you were right now to, if you had a crystal ball to look into the future, how you see the market really evolve in the next 5-10 years, if all of the leaders within healthcare knew what kind of technology can be implemented immediately? What is the wishful thinking for that market?
I think really it has to, as mentioned, the doctors are very busy, the nurses are very busy. Really, the technologies are there to support. They can never replace necessarily the doctors or the nurses. But for us, the case tests that we're seeing very good marks is in the imaging study space in terms of AI. We're seeing that the machines actually can pick up on pulmonary embolism very well. They can pick up on nodules very well that we miss. So it's really just really freeing up our doctors and nurses to practice at the top of their licenses and do the things that can be automated. That's where technology is going to help us. It's also going to help us in terms of really understanding, access and access points. I think for patients, it's really hard to navigate through the ecosystem of healthcare. Often, people who are fortunate that have friends and family, as you know, anyone on this panel will tell you, they tend to just call us to figure out, well, how do I navigate the healthcare system? Well, it shouldn't be that way. When, Uber or all of these technologies make life easier for you. And that's the expectation that patients have in some ways, that things should be very seamless. And we're not quite there. So I think that's where, technology is going to help us. And if we're able to be more efficient, we'll save on costs. A lot of costs is based on a lot of redundancies. If someone comes to my hospital, they had just been at Cornell yesterday, I may repeat their CAT scan just because I don't have access and I can't see it. There's so much waste in this system, and I think that's where technology is going to help. The other thing in terms of technology I'll just mention, because it has been mentioned, but is a threat for us, is cybersecurity. Unfortunately, we are very vulnerable, and as we add in more and more data points and places of entry into our system, that creates a lot more vulnerability. And I don't think anyone has any great solution for that. But cybersecurity is a threat that we also have to discuss.
Can I just mention something?
Please do.
I think one place where, healthcare is one place where technology has a maximum role to play across all different industries, because, whether you take surgery, you take, detecting a disease, or, wellness, you take any area, you require technology. But I think one technology, I don't know if it comes up, I think it's already there, but I don't know for what reason it's not being implemented, is where, let's say, for example, you have a patient where there's no surgeon available. Let's say, for example, in a small village, you require to do a surgery. And you have the robot or whatever, which can do a remote surgery. And, right now, though the robot can do a surgery remotely, it's not, kind of practice. So if in the next 5 to 10 years, if that is possible to have a robot perform a surgery without the physical presence of the surgeon, I think that will probably move mountains, because many times the patient is unable to reach the healthcare facility for various reasons, and he is unable to get the treatment done. And I think that is one thing which can profoundly impact the number of people who can be cured of whatever they are suffering with. Thank you.
I just want to mention, can I jump in? That was a very amazing point. And I think it also speaks about our workforce. And I think we traditionally think of the doctors and nurses. There are people we have to train in the future who will be able to leverage those technologies, get the patients prepped, get them ready, use those technologies. So I think we have to look at the workforce and what's coming in the future. And are people excited to enter healthcare still?
That's thank you for that last point, because that as a person who likes science fiction, and I want all of that science fiction to be today and not someday in 100 years from now. Even though I may be not so happy, because usually robots don't have hands, so that might take some of challenges for us as Soapy. But how you see an adoption, and Dr. Eve, you just mentioned that we need to train people, right? We need to maybe not nurses, maybe not the physicians, but we need to train people for those kind of technologies. And I'm curious, how can you see adoption of those technologies within population that is not specifically coming from healthcare, but want to be part of healthcare? And definitely in the last mile journey of the technology. Karen, maybe you want to jump into that question.
Yeah. Thank you so much. So I was raising my hand. In fact, I wanted to comment on the earlier bit also. So I think when the point was being raised about reaching the last mile, I think in a country like ours, India, which is densely populated, and you've got tier 1, tier 2, tier 3 cities, and you've also got many remote locations. I feel it will take a lot of effort for our technology to reach the last mile. And when I say that, well, please understand, if we have bigger cities like the metros and the tier 1 cities where people are well versed with tech, they are okay. They understand, they have educated, they know how to use the tech. But when you talk about the remote locations, still there's a fairly larger population size who would want that physical touch of a doctor. They would not, because it's life. Now, if we deal with commodities, a handset or an FMCG product, I understand you can see the advertisement and buy it. But at the same time, when it's concerning a life, people would still want to come in that consultation chamber of a doctor, sit with him or her, explain their problem. And I think there is the catch where a lot of them don't have an access to tech. And when I say that, there are obviously enough material and reasons for it. Now, in the most remote location, the Wi-Fi connectivity is not so nice. When you talk about the cellular data points, obviously there's a lot of buffering, streaming, which happens. And when you're doing a consult, you've got major ailments and diseases for which you need to cure or you need to talk. Obviously, those facilities are not available. So I think that is one bit of it where our tech, which plays an important role, but still it's not reaching that last mile. And it is difficult to bring that individual, that patient into the main city. There are many reasons to it. Affordability, when I say, obviously it requires a lot of effort for that individual to come to a bigger city. They have to arrange for tickets, they have to stay and arrange for some accommodation. And let's not forget the treatment cost is different. And when you talk about life, a lot of us, a normal person would do a lot of window shopping. You will talk to your near ones and dear ones to understand, where will I get cured? Who's the best consultant? And again, because it has a price point, how much will I pay? So a lot of factors are pushing the tech, but at the same time, we can be dependent, it's important, but at the same time, not fully depend on tech, because in a country like ours, we have a lot of work to do.
Karan, thank you for saying that. I can tell you, as a person who is traveling quite a lot, thanks to Soapy, maybe not thanks, but because of Soapy, I think that in many countries, people want to get help from people and not from call technologies. They want to know that good quality of technology is there in helping and making the best of it. But people still want to get in touch with people. And actually, Dr. Ilan, I know that you had a crazy growth within your facility, and it was growing pretty rapidly in the last 5 years, at least from what I learned from the small research that I've done. Do you see similar things? And you mentioned that like patients do want to get quality, and they don't care about the technology. But if you are to kind of I would say to split, how important is still to get that human interaction between the patient and the caregiver? Is it changing from what you see? Is it not?
No, I am a firm believer, and I believe, I think my friends, colleagues who are there, they can voice their opinion as well. But when these patients with whom I interact on, when I come across, I would still firmly believe a lot of them would want to have that physical touch and that physical conversation. And please understand, if you categorize the kind of ailments or diseases or the reason why they come to a hospital, please understand there are some things which are quite simple. Now, if someone is having a normal viral fever, still they would do that interaction over the phone, or they'll try and understand over emails. But when you talk about some complex things coming up, I think they would want to come. They would want to have that interaction. And obviously, because it's privacy, they would also want to probably discuss at length. Unfortunately, tech gives us that opportunity, but at the same time, there are some surrounding factors to it, which is not the case when you are dealing with a person in front of your face. So though things have changed, but still on similar lines, I'll say it's more or less like it was earlier. And let's not forget the fact the normal population is much more educated. They have many more questions, which was not the case earlier. So in case if you're talking, I am in front of a doctor, I know that, okay, whatever he or she is telling me, I can have 10 more questions and I can ask, which I know till I'm satisfied, I'll not come out of that chamber of a consultant. So yes, they want that.
So I think, one more, sorry, I think what I was trying to probably interject is that today, maybe, 10% of the population who has a problem actually reaches the place where it's delivered, the healthcare. 90% of the people, let's say in a country like India, they are unable to access healthcare. Like I remember in Johnson & Johnson, we had a model which the first was accessibility, then would come the affordability. If you're able to access healthcare, then you can afford it. Then comes the awareness of what is the right technology or what is the right treatment, So point is that, we'll have to use tech, like how tech has disrupted different industries, completely, and brought solutions which sound so simplistic. So, like how mobile phone has made desktop computers redundant. Similarly, what I'm trying to say here is that today, if in a remote village or a remote town, you have a patient and he's unable to access, you may start with simple things. Even our camera on the mobile phone, it was never 200 MP. It was, we could not even see the face properly. But simple surgeries today, for example, we have robotic surgery, which we offer for prostate cancer. Now, you don't require the surgeon. That robot has hands. It's got 3 hands. It does the surgery by itself. The surgeon is sitting on a console. The only thing is the surgeon is in the same operation theater, in the same room. But if you can start with simple surgeries which are done, and you don't need to rely on Wi-Fi. For example, in India, we have ISRO, which is the Indian Space Research Organization, which provides bandwidth to, remote areas. And using that bandwidth, let's say you can start with simple surgeries where you have doctors who are there at that point in time and who can help to do small things. And that can completely transform the, way healthcare is practiced. Yes, you can have a doctor going there, looking at 1,000 patients, saying this 100 requires surgery. His junior doctor goes there, and there's a robot which helps. The junior doctor is around, the surgery is performed. Imagine the number of patients you can touch. Imagine number of patients who can receive treatment, which today 90% of patients just don't receive treatment. That's what I'm trying to say. The use of technology to disrupt an industry and bring about a profound change.
Thank you. Dr. Ilan, I also saw that you wanted to give a couple of comments over here, right?
To follow up Zubin's comment, right now, robotics, it's too early stage. Basically, robotic doesn't do any surgeries on its own. I think it's all robotic assisted. I think a surgeon needs to completely do the surgery with robotics assisted. I think it might take some more long time to reach the stage where robotics can perform on its own or in a remote stage. I think we may talk about, we are talking about 10 years or 20 years later. I think that's a possibility. I just want to touch a bit about telemedicine. I think telemedicine has become very popular in the last few years, at least in our country. Again, it's not a new innovation or new technology. The technology, it's a video conferencing, has been there for many, many years, at least 10, 15 years, it has been there. I think we are offering a new service with the existing technology. So how we can maximize the benefit of telemedicine? We need more information. Whether telemedicine can replace doctor, AI can replace doctor or nurses, I think I would say many of the technologies might not be able to replace humans in healthcare at all. All these technologies are going to enhance people's skills, enhance people's reach. If I'm providing a service in one area, in one pin code, say postcode, I may be able to provide the same service in multiple locations at the same point of time without traveling anywhere. So increasing the reach, enhancing my skills, I think these are the two things technology are going to do. In terms of telemedicine, currently it's like a video conferencing facility. Maybe in 2-3 years time, 5 years time, when there are more and more equipment comes in, patients can buy the equipment attached in their skin that can measure all your blood tests, all your vital parameters, even actually with the AI inbuilt that can tell you the full history of the patient, and it can also predict what's going to happen. If those technology comes in, then telemedicine will have more value. People might not need to come to hospitals. And then a lot of the chronic conditions like a skin disease, diabetes mellitus, hypertension, those kind of patients need not to travel to hospitals. But acute conditions, still patients have to come to the hospital because we haven't got enough technology. I don't see those technology coming up in the next 5 to 10 years time. I'm sure to treat chronic conditions, things will become very easier using the telemedicine. I think we have to have complete clarity on how much we can use each and every technology. And that's what I was trying to say, Max.
I just want to, Max, I just want to jump real quick on that point. I think it's an important point of what technology could do for us. I think we often think of the bricks and mortars, the hospitals and people coming to the hospitals, but the technology is really allowing us to really give care in any setting. And one of the companies I advise is actually they take care of patients in the home. And you could do a lot of preventative stuff. You could do chronic stuff. And you could also do follow-ups for patients who've come to the hospital before. If they're in a remote area, yes, they may need that initial acute stabilization, but once they go home, we can follow them and to make sure that their case doesn't deteriorate. So I think that's the other evolution. It's almost like we're going back to where we came from, where doctors would go to the home. Technology, I think, is going to enable us to do more and more of that. So that's exciting in so many ways.
And at the end of the day, patients are only looking at the outcome. That's what people are terming it as value-based care. I think US has started practicing a value-based care where patients are paying based on the outcome, not for the kind of service you are providing. And then even US, they want to reduce the cost through value-based care. I think this concept will get adopted across the world. I'm sure all these technological innovations will help assisting in this value-based care, where reducing the cost and improving the outcome, patient should only feel they are paying for that outcome, what they are receiving it, rather than what technology we use it. I think that's how we have to balance the new technology, bringing new technology, applying to the patients. I think there should be a balance maintained between these two.
Dr. Ilan, have you seen a prostate robotic surgery being done?
We are one of the largest robotic center in this country.
So
we have two robotic Da Vinci machines in our center.
Right.
Actually.
So if I may
except for creating the ostium to enter, I think the entire surgery, even at Kokilaben, we have two robots at the center. And what I have seen is that the entire surgery is performed with the 3 hands of the robot. And that is what I was referring to. So I'm not a doctor. I'm just trying to say that. And I always wonder, why is it that you can't do it remotely, to be very honest, because, yeah. So he sits on the console.
You're absolutely right, Zubin. I'm not against your comment. You're absolutely right. Even some trials are going on. Even recently, one of the surgeons did lab surgery from London in US. But still, we need a surgeon at this point of time. Maybe some of the surgeries, you're right, absolutely right, maybe can be done by robotics, but still it doesn't evolve that much. Yeah. Exactly. I completely agree with you. I'm not against your comment.
This is a fantastic conversation. I can see emotions coming out. I can see this interaction, which is really fabulous.
No, it's about saving lives, So when you're talking about saving lives, 90% of the people can't be saved. You feel so bad about it at the end of the day, And yes. COVID taught us this because you could not access the patients and your junior doctors going, into the COVID wards, and the senior doctors, for the sake of treating more patients, would stay and do it remotely. We saw that COVID taught us that you could do things remotely. So, that's where I'm coming from.
Definitely. Max?
Yeah, so I'm also excited about all what I hear. By the way, I was excited to learn that the robot that you were speaking about, Zubin, has 3 hands and not 2, which means we have 1 more hand to wash or sanitize. But beside that, I think that if I can summarize the conversation, healthcare is complex and we have many more things to discuss. And definitely, the minimum time that we have right now is not enough. There are many things that need to be solved and there are many things to come. But what I hear right now, and I was trying to summarize that from different points, we still have a lot to discuss about safety, about quality, and about affordability. Safety for things like making sure that education is in place and we have more practitioners in the market that can do a best quality work, that can reach to the client, to the patient, where they need that and not drag them into hospital when it's not needed. To use telemedicine, but also not to lose quality of how we provide the treatment to our patients. And when they need to come, so we need to be able to actually say, you need to come over here using the technologies that we have. And cost, value-based here, I think I would love to see that future happening everywhere, because if we can pay for the quality and the care that we need with the right outcome, everyone is happy about it. And we are in medicine to save lives, to make people live better. That's the core idea of practicing medicine, at least from the what I know. So thank you so much for so many more questions that I have out of the few that I asked. And Pankaj, I don't know if we can go and.
I think this is a fantastic time to move on to the next piece of the event, which is a roast session, where panelists have given some fantastic responses to the questions that Mex has asked so far. And now it is time that Mex presents what Soapy is, what is the Soapy solution, how they are better than the competitors. And then I would love these panelists to roast Max on the competitive landscape, on the technology and things of that nature. And my request to the panelists is that please don't be shy, don't hesitate, don't be soft. You could be as brutal as possible with your questions and feedback. So shall we start with that? Max, please go ahead and share screen.
Okay.
And while Max is trying to share his screen, I see some comments in the chat section as well. Again, good to see the feedback from the audience. Please go ahead, Max.
Thank you. Well, be brutal, but not so much, please. So Soapy started back in 2018, and we have several use cases around the globe, including different use cases in departments, starting with ICU up to long-term oncology, BMTs. The bottom line of our technology is that we have proven to improve hand hygiene adherence, reducing HAIs and improving quality, and all of that all together. And I'll jump into how we do that in terms of technology in a few slides. But to summarize for the not only for the panelists, but everyone who joined us, infection prevention, as Zubin mentioned, and Dr. Eve mentioned, Dr. Ilan mentioned, and everyone mentioned right now, is a major threat and a major concern for the patients and for the healthcare facilities. One of the main challenges is that work most of the times is still done manually by the infection prevention team that not always have the mandate to do things as maybe the regulation expects. At the same time, we have proof that if you improve hand hygiene, infections go down. The more you improve adherence, the more you improve quality, the less infections you're going to have. We have seen those reports in the last 200 years since Samuel Edelweiss started speaking about that. We also, as a company, proved that with several of our clients. And we proved that through using a very different concept. We use a technology that has customer-facing core DNA, saying we need to make sure that our clients, our users, actually practice the best hand hygiene. So you have a physical device, because we still have hands, even if the robots will have 3 hands, we still have hands that we need to wash and sanitize. You don't need to touch anything with our technology. You reach with your hand, then the system will recognize who is standing in front of the unit and what kind of sequence is needed for this environment. So if it's hand washing, it will be pre-designed for hand washing. If it's a hand sanitization, it will be preset for hand sanitization. Tutorials on the monitor will show exactly each step that needs to be done for the best practice within that use case. And then multiple sensors will verify every single movement, gestures, friction, etc. and will analyze roughly 100 data points to provide a personal feedback immediately at the point of use. This is still number one. After that, all of that information is analyzed and sent to the cloud to provide the leadership of the facility a quality report showing education, personal feedback, trainings, quality, and many more parameters through the entire facility and multiple users. Just to give you an idea, we are not changing the right quality of hand hygiene in terms of the science. You need to scrub your hands a specific portion of time. You need to use a specific volume of solution when you're scrubbing your hands or when you're hand washing your hands. All of that remains the same because we can't change the science and the biology behind that. But what we have done is we created technology that supports the user to do that in the best quality possible. On top of that, we use all of that information that we collect, all of the 100 data points from each and one of the cycles, to gamify and to create transparency, and not to create a big brother or to create an extra burnout to watch everyone in the facility. So what I'm trying to say, the technology, and we mentioned that during the panel, is looking at how we can elevate and empower the clinicians, the nurses, and everyone within the facility to practice what they anyway want to practice, which is proper hand hygiene. And then after you do that, you can use reports like you see over here in the picture to create gamification, self-governance, to create group or department reports. But that's the second layer of what you need. First layer, on the ground, helping users. We use user feedback. If you know Leapfrog and Joint Commission, you know why it's needed. We do it at the point of care when the user is actually practicing hand hygiene. We use that to educate and elevate again and again and remind everyone how to do things and when to do them. We eliminate, if needed, not if needed, we actually eliminate every junction of pre-infection of the facility. Everything is touch-free. And we make sure that the water is at the right temperature, with the right volumes, with the right flavor if needed of the soap smell. Same thing about the hand sanitization process. IoT capabilities, as you know, everything is controlled remotely. You can change everything, improve maintenance, and improve trainings. At the back end, just to give you an idea, the patented technology that we have, and we have 4 patents, is actually translating every single thing you're doing with your hands according to multiple publications that say, if you do that gesture properly, this is the volume of infection that you remove as layers from your hands. So as long as you follow each and one of those steps properly, you actually end up with clean hands at the end of the process. And we analyze that in real time. On top of that, gamification, being user experience oriented. We use the displays that we have to have positive empowerment of the users, to remind them procedures that they need to remember in healthcare environment, not only for infection prevention, even for communication with the patient or with their families. We can use that display to advertise specific HR messages or brand advertisement for the entire facility. We have several units and we have several setups that you can use. You can use that for hand washing with soap and water, or for hand sanitizing with alcohol-based scrubs. You can have a wall-mounted unit. You can have a deployed unit that is mobile. No infrastructure beside electricity is needed. But at the end, the question is how that works. And my reply to that is that in all of the facilities where we have our technology installed, we see an increased adherence week over week, months over months, year over year. And the adherence is not just, okay, they sanitize and wash their hands more often. It's actually quality reports. So we know that the quality of those events increasing over time and improving, which means you get more hand hygiene events with a much higher quality, and you can slice and dice it for nurse-specific education and support, clinician-specific education and support. You can take it to step-down units. You can take it to almost any department, starting with education and ending with reducing HEIs to up to 20%. And those are the results that we see. The volume of the data that we generate is, just to give you an idea, one of the use cases that I just presented, over the last 10 months generated 3.6 million data points on hand hygiene quality through the entire department. And I'm talking about just one department. So we know if you're washing your left hand better than your right hand, and we can use that information to a much more educated conversation and not just saying, Max, you're not washing your hands. We can say, Max, you are washing your hands. And this is the way you can improve to make sure that the patients are safer, to make sure that the healthcare that you're providing is on a higher quality. I'll summarize all of that with one of the statements from one of our clients that's working with us more than 2 years. You have many technologies that can diagnose infections on hands, multiple. You have scrubs, you have computer vision. Soapy is a treatment to a disease because it's a preventable technology, okay? And we hear the same feedback from the VA in the United States, Sheba Medical Center in Israel, San Paulo in Italy, and many more clients that we have. So I'm ready to any questions that you have. Please be sensitive, but bring it all.
Yeah, I think this is fantastic technology which you have got. I think it's one of the most amazing, things which can revolutionize, the hand hygiene, infection control. Just two questions I had to start with. One is that what is the certification in terms of its use for patients, or is it still in the kind of pre-market launch stage? Do you have any installations in real life, and what are the kind of those experiences? Thank you.
Zubin, thank you for the question. So we have all of the certifications that are needed to install this kind of technology in healthcare environment. We don't need to go through any clinical trials, even though we have done clinical testing with many of our clients. But we have all of the safety certifications in Europe, in the United States. And we do have, by the way, units installed in India as well. So the technology is launched into the market. We're getting to 1,000 units deployed by then, but in the very near future. And I'm happy to share more about that.
Max, can I make a comment?
Please.
Max,
Please
I
do.
think, first of all, congratulations. A fantastic mission, actually. I'm an intensivist. I feel you'll be adding a lot of value to the community because I would say hospital-acquired infection is one of the biggest killer in the healthcare industry, which not only increases the mortality, but also increases the expenses to the patients, actually. I think it is a fantastic tool, even for a healthcare administrators. It's important for them to monitor whether people are following hand hygiene measures appropriately. I think this will help people to learn special skills, and the team leads can monitor whether people are following these tips appropriately. I would really congratulate for bringing this innovation to the healthcare community. Thank you very much.
Dr. Ilan, you had to roast. You were supposed to ask brutal questions, not give compliments.
No, I just wanted
Absolutely.
to. I know that. I just wanted to compliment him because I felt it's a good one, actually. So I'll come back. I'll come
Again,
back.
coming back to the question of certification, what I meant is that this is what your technology claims to do. There has to be an independent certification body which will say, yes, this is what it does. It's right now what you're showing to us is what or at least what I understand is this is what you as a company is presenting. So is there something which has been certified that what your company is presenting is actually a fact, is what I'm trying to ask.
It's a great question. We do have white papers and publications with healthcare facilities that tested our technology at the beginning. And they report results that not us reporting. So we actually using results from healthcare facilities that tested our technology. One of them I actually showed over here in the presentation was not our peer review, was not our white paper. If you know about the EBMT symposium that is happening in Paris, which is the biggest bone marrow transplant symposium in the world, one of our clients is going to present their result of there. We just applied our technology, and it's going to be presented over there. The results. It's not Soapy. We have no take into that beside being the vendor of the technology. I hope that answered the question.
It partly answers, because you will have a submission of your technology for commercial use based on all this research and other things put together. I mean, I understand that this is somewhere you have tried this product out and they've got those results, but it has to be finally, kind of approved.
So, Max, I think we should take that question offline in a separate discussion. I want to make sure that we're able to take more questions.
Yes, and I would like to learn more about what kind of institutions can give those kind of certifications. Thank you very much.
Questions, Karan or Dr. Eve?
Well, I have to disclose I am an advisor to Soapy. And so obviously, fundamentally, as Dr. Elon mentioned, we see the value in terms of the technology. I would just ask Max, questions of, we mentioned the providers, the nurses are running around, they're very busy. Where do you see the term in terms of what's going to make what's this technology going to help to make them pause and stop and use? Or what is it about the technology that makes it, you think, appealing for them to improve? I know within our system, we only have 20-30% compliance. It's a shame to say that. And I think we all suffer from that. So what is it about this technology that's going to change the behavior?
Dr. Thank you for that and for disclosing. And it's a question that we discussed a lot. I think one of the core values, and I would say maybe even the unique selling point of our technology, on top of many other capabilities, is that we help to shift culture from unpleasant discussion about hand hygiene and the importance into a fun process. And the reason why, and actually, I will use the reference right now, because we do have clients that said installing our units in ICUs, which is one of the most intensive environments in healthcare facilities, that the 20 seconds when they stop in front of the unit, those 20 seconds for them is their 20 seconds to stop and relax for a second, get a smiley feedback at the end of the process, and then continue their day. Because if they don't have that stop point, they actually continue to run, trying to kind of, yes, I have done the sanitization process, 3 seconds, maybe 4, maybe 5, I don't remember, I think it's good enough. And then I interact with the patient. While when they use our unit, they know for sure that what they have done is the good process. And the next interaction with the patient is without the extra potential risk of infection they can bring in. So for them, it's easy of thinking on top of, it's a fun process. You don't need to think about it. You reach your hands in, you get all the tutorials, you have some extra information that may be about a fun day that is going to happen in the facility that you don't remember about. So I think using all of those small psychology points that we can do with our technology is elevating and shifting behavior into understanding this is part of the basics that we need. And we discussed it in the panel. We can't forget about the basics. People want to get treatment from people, which means we need to make that safe. And sometimes that safe means go back to the basic 20 seconds of hand hygiene, of hand scrub. So I hope that answered the question.
Yes, thank you.
Thank you.
Kevin or Karan?
Yeah, I still am not, what I would do just, probably I'm not able to phrase the question. See, today, for example, if you don't have this machine and somebody is trying to sanitize his hands, he doesn't know or she doesn't know whether it's been done to the level it is supposed to do. Am I right? Is that the problem we are trying to address, right? So with the help of this machine or the help of this technology, we eliminate that problem of uncertainty that your hands are sanitized to the level they are required to be sanitized. Now, this proof of concept to be accepted by the scientific community, by the doctors, by the hospitals, by infection control departments, that is the certification I'm talking about. There are trials which are done to help to bring the technology to a point where it looks that it can be, accurate to the point it should be accurate. But finally, some certification, like in every other technology, there is a certification. That certification is what I'm just trying to understand, that whether it is already there or it's in the process of getting there. For example, in US, you have, let's say, US FDA, or any other countries have their own medical certification or regulatory bodies which certify every device which is to be proposed to be used in the healthcare setting. Am I my question clear now?
Yes.
Or?
It is, and I think that I might have an answer for that. The first is that we don't need to have an FDA certification to work in hospitals. It's not needed for this kind of a technology. Can we do that? Yes, we can. Will we do that in the future? Yes, it's part of the roadmap, but it's not a must to actually work in the market. And because we can show references from other facilities, and usually that will happen with almost any new client, we can already show references from other facilities, from the community, that actually prove that our technology delivers our promise. We are very confident with that. We have never lost a pilot with any of the clients, ever. And the reason for that is because it's not that we overpromise or underpromise. We say things as they are. We know what we can deliver with our technology, and we prove that with we have proven with many clients, and among them is hospitals that are in the top 10 global wide. I don't know if that replies, Zubin, but I know what you're saying, and I know exactly what you are meaning over here. If it's a medical device, you need to have something from a third party that proves that medical device provide the medical quality that we promise.
Right. Plus, yeah, I mean, that's exactly the point, because at the end of the day, this is a medical device. It's performing a function which is required to be, making sure of certain, thing like hand hygiene, which is a very critical thing. Secondly, when you're saying that our proof of concept is not failed, so what is your reference checkpoint? So, for example, if I put my hand in your machine and it tells me, okay, it's 100% clean, how do I cross-check it with some countervailing, whether I take a swab of my hand and send it to a lab, or how is it? What is the reference point?
Yeah, so that's a great question. The reference points that we use several. So the professor that you see over here on the slide, he actually tested our technology for a year and a half, I think, using swab test and other spectroscopy technologies to validate if hands are clean or not. And he reported that several times in different places in Europe, and showing the correlation between practicing hand hygiene with our technology, getting the 100% result versus the swab test results, and the other getting 10% results versus the swab test. And there was a high correlation between that. When we develop our technology, we used publications and scientific data that actually shows the correlation between those two things. And you can cross-reference that this way. So again, you can use technology. You have two companies. I can send those out if you want. One is from the States, that one is from Europe, that using spectroscopy to validate cleanliness of hands, or you can use the regular laboratory swab test. We are good with both.
Okay. No, because this is fantastic. Only thing is, it has to be, kind of validated in a, by a neutral agency. That's what I'm just saying. Otherwise, it's fantastic. I mean, it's really wonderful. But
So
it has
Zubin, to answer your other question, when Max was talking about not losing any customer after POC, he means that once they have done a trial with a customer, they haven't lost that customer after that successful trial. And generally, that's not the case with the startups. In most of the startups cases, you probably only retain 50 to 60% of the customers after the pilot. And that's even that 50 to 60% is pretty optimistic, right? Now I see there are questions in the chat. What will be the cost of this project to install in a hospital with a capacity of 100 beds? I think this is a question that should be addressed offline in a separate conversation. I'm not sure who is SYT, but yeah, please connect with Max or with us to take that question offline. But
I have a question, Pankaj.
Please, Dr. Ilan.
Yeah, it's almost similar, but I know that you won't reveal the price here. See, we are say 400-bed hospital. I don't think 1 or 2 machines will be enough. We might need 50 or 60 of those machines. What's a return on investment for those kind of machines? Because we can't charge the patient directly. Of course, it will reduce the cost by decreasing the infection. There's a possibility. But what's the ROI for the hospital per se when you install 50 or hundreds of machines in a single institute?
That's a great question. I will address the pricing later if that's okay, Dr. Ilan. We can have that as an offline conversation. Yeah. We can really look into that. But to give you an idea, when we were speaking about ROIs in Europe or in the United States, from the calculations that we have done with the clients that we have today, we are speaking about, let's say, 150 bed facility, which is medium small in the United States. By preventing roughly around 9 infections a year, they are break even for several years ahead. Because the infection costs in the United States are very high. They can go between $35,000 and $100,000 per case, but that's the system over here. So the ROI is sometimes almost immediately. If you're thinking about a comparison between the existing solutions in the market right now versus the technology that we have, then you have many more parameters that need to be included, including training of the teams for hand hygiene, infection prevention, monitoring drivers, and education of the practicing team in the different departments. All of that can be included, and we have calculators, so I'll be happy to go through that together and include all of those parameters for your facility and show you the ROI. But the ROI will always be less than a year, sometimes in the 6 months, if you include infections that we prevent that can go almost day one. So it depends on how you look at the spend related to infection prevention and hand hygiene training and monitoring.
Yeah, thanks, Max. I just wanted to combine ROI to Zubin's question. Zubin's question was excellent, actually, because are you doing any research to find out your mission reduces the investment cost compared to available technique, which is better? For example, there is an available technology, of course, that also reduces the infection rate, and then you are investing a huge money. How do you calculate which one gives more ROI in these two? Are you doing any research?
Yes, we do. And we compare to other digital technologies that can help with small sections of what we are speaking about, which is monitoring, or comparing our technology to smart hand hygiene or hand sanitization stations. Just to give you an idea, a regular mobile hand washing station in the United States, okay, hand washing mobile station in the United States, the cost is between $2,000 to $4,000 US for just the device that can dispense water and soap. And that's it. So just to give you an idea how that market looks over here in the United States. When we are speaking about our technology, we have 2 options. And again, we can discuss that. We have a monthly subscription or we have a purchase option. But when we compare us to available technologies, we are much more cost effective to the advanced technologies. We are definitely more cost effective to retroactively analyzing how the education for proper hand hygiene happened and if it actually facilitated prevention of infection. or improvement of hand hygiene adherence. We are much more cost effective than the existing solutions today. And again, I can take that offline and show all of the calculations.
Sure. Thank you. Thank you, Max.
Pleasure.
Okay, there are any other questions from the
Yeah.
hostess or from the audience? Yeah, please.
Yeah, so, one more thing I'm trying to understand, because see, hand hygiene is a problem which is so, vast. It can be a, right from, and one is you're looking at a healthcare setting to start with, you're not looking at the non-healthcare, because there also, hand hygiene plays a role, but in a healthcare setup, it's about life and death. So right from an OPD setup to a surgical setup to an ICU setup, and, even to a, field, surgery clinics or field. When I say by field is, let's say you are doing a camp in a remote area and you're doing surgeries like cataract, or you're doing surgeries like, small surgeries, things like that. So the places where this product can be used is phenomenal. So is your company, I think if it's looking at a very, high price point, it may actually miss the entire market. That's what I'm just trying to make a point. I'm not assuming it's an expensive product, but I'm just trying to say that the market is so huge. I think that's what even Dr. Ilan was trying to say, that you can be inundated by the number of devices that you want to sell. Of course, depending on the price point that you want to go at. And of course, you'll have to keep in mind also the how easy it is to take care of your IP, because if it's something not too difficult, you might have cloning happening very soon.
Those are very fair points, Zubin. Thank you for that. On the IP, and I'll start with the last point on the IP. We have 4 patents: Europe, United States, Israel. They are not just patentable, they are very patentable and very protectable. We actually had a third-party review on all of them to understand how, before we continue from PCT to a full patent, to understand if there is a sense to continue with those patents, or if we're just doing patents that we can't really protect. So I'm very confident on that, and I'm excited to say that. On the price point, I think right now the company is in that magical position when we are happy to discuss the price points with potential partners and clients. And because we are not yet into a big corp that has a fixed price, and that's what it is, right now is the point where we can actually have that discussion and make that adjustment to our clients to go and deploy more units, and not just go and say, here's 1 unit, tell us how it goes. We are hoping that one day, with the technologies that's incorporated in Soapy, we'll develop more products that will solve every single section hand hygiene related challenges in healthcare, and then going to pharma and many more healthcare related markets. And we think we can do it. So you mentioned surgical related. A surgical scrub is a very different animal. It's just different. I'm coming from the market, so I know it's a different animal. But at the same time, I'm very excited to say that we just started to work in the pre-OR use cases. And for now, the results are amazing, and want to expand that. Pankaj, you know more startups than I, but maybe you can refer to that. I think it's an exciting stage for a company to be in, to have still the flexibility of a startup, but already have a product that is actually delivering its value into the market.
True. You'll be surprised, in India, many small facilities, their scrub is some kind of a joke, to be honest. Many government hospitals, I'm sorry to say, or even in small places in remote towns, those surgical scrubs are absolutely a sham. So that's what I'm saying, in the size of India, you'll require a factory in India to take care of your demand if it really flies through. Trust me. I mean, I worked in J&J and I know what I'm saying. This device, if it is at a price point and it's at a accuracy which you're claiming, the sky is the limit for you. I'm not trying to praise you. It's not about not roasting you, but where opportunity is there, you have to acknowledge it.
See, we love it even more when roasters become the fans. So that's a good one. But again, really appreciate everybody's time today. I think we had a very, very fantastic, insightful discussion, and I love the feedback and insights from the doctors and from Zubin and Karan from Kokila Ben and Apollo Hospitals, talking about how empathy is so important, how technology cannot solve all the problems, right? And let me just mute. Okay. So really appreciate your time, and I believe that this is not the end of our relationship. This is just the beginning, where we are connecting with each other, and I'm sure there'll be a bunch of areas where we can collaborate, we can help each other. So let's reconnect again in the next few weeks and months, and take it from there. Again, thanks everybody. Really appreciate your time. We'll talk soon.
Thank you.
It was a pleasure. It was a real pleasure. Thanks so much for involving Pankaj. I really appreciate it. Fantastic.
Thank you.
Thanks to all of you. Thanks to all the panelists.
Thank you, Dr. Thank you, Dr. Ilan. Thank you, Karan and Max.
Thank you so much.
Thank you very
It's
much.
a pleasure to be a part of this.
Thank you, everybody.
Thank you very much. Thank you. Have a good day.